You know what? We're okay. Let's start the meeting.
We're fine. It's 7 o'clock.
Yeah.
All right.
Start
All
the-
right. We will go. We will call the meeting to order. It is now 7 p.m. Hold on one second. Do we have anyone from the public? Anybody for public participation?
We have a lot of people on.
Is there anyone who wishes to speak to the board? If you do, if you could please state your name. I guess there.
No, okay.
No, nobody wants to speak. Okay, so we'll move on from public participation. We will close that at 7:01. And if we can read the minutes from the meeting on September 23rd.
Yep, I'll make a motion to approve the meetings as written from September 23rd.
Minutes.
Okay,
All right.
minutes.
I'll second.
Okay, that's a second. All in favor?
Gorville, aye.
Linehan?
Linehan, aye.
Aye. Okay,
All right.
so moved. We'll accept the minutes.
Elaine, did you
yeah.
vote?
Yes, I did. Did you hear me? I'm
Yes.
sorry.
Okay,
And I said
Great.
Silva, yes.
got it. Okay.
Okay, it's all three, so moved. Our next thing on our agenda will be the health director's report. Ruth?
So I was on vacation last week, so that eliminates a lot of things to talk about. Things are going fine. Coral is able to do the food inspections and the complaints. We have hired an inspector part-time temporarily to help keep up with the inspections because we're getting so many COVID complaints. When the eviction moratorium ends, we anticipate getting a flood of tenant complaints who will be trying to delay their eviction through violations of the housing code. The Stop the Spread program for free COVID testing for anybody has been extended through December. So that is important and big news. Having been to a number of other states, I will tell you that Massachusetts is heads and shoulders ahead of most of the rest of the country in having it super easy for people to get tested. Anybody, anywhere, any reason, no payment. The closest one to us is the Saugus Mall.
Yeah, I've heard great things.
I've been there twice.
Yeah, I have.
Yep, and they're fantastic. They're open every day except Sunday, I found out, from 2 to 7. So it's the Square One Mall parking lot, 2 to 7 every day except Sunday. And if anybody is interested in getting tested, I highly recommend that. There are Stop the Spread testing sites in about 20 locations or 20 communities throughout the state. If you go on mass.gov and put Stop the Spread in the search engine, it will come up. In some communities like Lynn, it's in a different location every day. Sometimes you need an appointment, sometimes you don't. So I recommend going online unless you plan on going to Saugus and checking out what's near you or what's most convenient for you. The state has made it very, very easy for anybody to get tested. So that's great. I continue to be on conference calls with the state Tuesdays and Fridays, and an additional Zoom meeting with health districts in the state on Wednesdays, which is very helpful. And I believe that's all the news at this point, where the group is still working on writing the mass call application. And I believe at the last meeting, I told you about the determination of need application. Did I, from Melrose Healthcare?
That doesn't sound familiar. I'm not seeing it on the minutes, Ruth.
Okay, so because Melrose Healthcare is building a new facility in Medford, they have to go through what's called the DON, or determination of need process. So when any hospital or healthcare system spends a certain amount of money in capital projects, a percentage of that has to go back in the form of grants to their catchment area. So they have $474,000 for DON money, and they've put out a request for proposal that we will apply for with Melrose. It's not due till the end of November. And we will be, it's a 4-year grant, $20,000 a year for the first 3 years and $14,000 for the last year. And it's based on systems changes for vulnerable populations. So Catherine had previously written a grant for another organization for food insecurity for the food pantry, and we're going to use that kind of as a basis and work off of that to expand it. And the town manager wanted to do it with Melrose, so it'll be a Wakefield Melrose proposal. So I will let you know once we're further along in that process.
So Ruth, just back up. Melrose Wakefield is they're doing a new, what are they trying to do?
They're building a facility in Medford for eye care.
Okay.
So because they're doing capital improvement versus over X amount of dollars, I don't know what the cutoff is. It's the first one we've actually had in
Forever,
25 years, because Hallmark Health just hasn't had that investment.
right.
So we'll take advantage of it. It's going to be pretty competitive, and we're competing against Everett and Malden and Medford, but
Yeah.
we'll see. We'll see. Candace, did you have a question?
No,
Candace is on time delay there.
Yeah.
no, I'm good.
Okay, sorry, I thought you had your hand up.
No, that's okay.
All right. So any questions about Health Director's report?
Is that it?
Well,
No.
I'm moving on to things that have not been posted.
Yeah.
Okay, sure.
That term is. So we put out a press release, I don't know, within the hour. And I'm not sure if the state website is post updated yet. I know they update on Wednesdays after 6. It's not always right at 6. So when they do get updated, Wakefield will be changed from green to red because of a large cluster of COVID positive cases that we have in Wakefield. We would have gone up to yellow regardless. We do get cases every day. And when you get constant cases every day, it's pretty easy to be in the yellow because you have to have less than 5 to be green over 14 days. So I think those days are gone for a while. So we do get a couple of cases every day. And I did send you, actually I have to send you an updated daily case. But the point is we have 16 cases at one location, and that's a lot in one spot. Obviously it kicked up our numbers into the red. I have talked to the school superintendent. I let him know in advance because we thought this was going to happen. I'm not recommending any additional policies or regulations or changes in school. This cluster is not it's not going to spread to the community. That being said, we do have a number of community cases. Almost all are households, and Elaine knows this because Elaine has graciously been volunteering and helping us with case management and contact tracing. We're seeing a lot of households now with more than one person in the household. You know, one person, usually one of the parents becomes positive, and then one or more of their household members also becomes positive, which is not a big surprise. So that's primarily what our cases are. It's not spreading from student to student. It's definitely adult to youth. The school department's doing a fabulous job with social distancing and mask wearing, so that even when there has been a positive student, sometimes they're actually remote, sometimes they are in the classroom. However, we haven't had instances where we've had to quarantine a whole class because the classes are following the social distancing and the mask wearing, which is exactly how it's supposed to happen. So all of that is really good. This is a really good opportunity, though, to do some more education and more communication with the community to remind everybody that social distancing and mask wearing and hand washing and staying at home if you don't feel well is very important. It's very real, and it's the only way we can contain the virus at this point. So I think the community is doing a really good job. Some of the adults who have become positive work in a relatively high risk area, and that's how they're becoming positive. And then of course, that's how their household members are becoming positive. But we are still at phase 3, step 2. We would go to step 1 if we are red 3 weeks in a row. I can't predict the future, but I don't think that we will be red 3 weeks in a row. I would anticipate us being yellow. Of course, the Board of Health can make stricter regulations if you want to, but I think the mask wearing is pretty consistent around town. Is it perfect? No, but I think it's pretty good, and the businesses and the schools are doing a good job with their part, and we just have to keep it up. I want to just remind people, you and other people, that the color-coded map is very helpful, and it's a great tool, but it's kind of it's a blunt tool.
Yeah.
So it doesn't differentiate what kinds of cases. So if you look at the current map, you're going to see a lot of communities that are red. However, some of these communities, and I'm going to just use a couple of examples, like Middleton is red, but Middleton has a jail. And they're red because of an increase in cases in their jail population, not because of their general population. North Andover is red because of Merrimack College, not because of their general population, and we have brought this issue up to the state, but they have said that they're not going to change anything at this point. So when you're looking at the map and you see red, you kind of have to dig a little further to see, is it red because there's widespread positive cases, or is it because there's a cluster at a school or a long-term care facility, or even a large household can do that. So, excuse me 1 second. Hold on.
Mute if you want.
Yeah.
There you go. She's yelling at Bob to get rid of the dog. So Ruth, are you still hearing? Okay. So while you're on mute, I have gotten some, some notices from community. I think Candace and I hang out on Facebook, maybe, in a good way, because Candace has been able to, she's more, push out, for instance, the state Halloween guidelines, but concerns again about certain stores that just don't seem comfortable asking customers to mask. Which,
we follow up on everyone that we know about, but I do not follow local Facebook.
Right. No. I understand. So I'm just speaking on behalf of someone who's asked me to. Just to be clear, the governor has certainly given police the power to imply, but I don't think people, would consider calling police. Certainly we have seen across the country some pretty, sometimes violent behavior, or certainly aggressive behavior back to store employees, such that they just don't want to put themselves in that position. So I just, I just wonder if the message, I just struggle with any better messaging. Like, we know you don't want to, but please, just, I don't know, just do it, rather, I don't know if you guys have thought of anything, but it just continues to puzzle me that this is so difficult for some.
Well, we I was talking with Coral today for updates, and we have given written warnings to a number of businesses, more than one business at this point. That means that they were given a verbal warning, now a written warning, and the next time we go in and there's a violation, they will be given a $300 ticket. So, and we have a number of those businesses that are in that situation. And then actually today, Medford sent me some signage that they made up that I just need to take Medford off. I'll send it to Jen and have Medford taken off and Wakefield put on. And then we were going to send those to to all of our businesses in a big email. And then the other thing is, normally we have a food safety advisory meeting twice a year. We didn't do it in the spring for obvious reasons. We are going to do it again in the fall. It will be remote through Zoom. So that will be an opportunity to talk to local businesses. Well, actually, I'm sorry, local food businesses at least, to see how they're doing, see if there's something more that we can help them with, and get their feedback. And it's actually done through our Public Health Coalition. So we have food service establishments from 5 communities and all different kinds of establishments, ethnic, mobile, school, pizza places, full service, a little bit of everybody. So I'm looking forward to that meeting so we can get some more direct feedback with the food establishments.
Ruth, is there a particular thing? Is it food establishments that are having the most trouble with getting people to comply with that? Or is it just the general stores?
Most of our complaints are from food establishments, not necessarily restaurants. Sometimes it's retail food, but it's mostly those. Not always, but mostly.
Okay.
And so if there are patrons who are not masking appropriately, is that an actionable offense? I think this is where people get stuck.
So this is what we do for that. About that. If the business is making a good faith effort to tell people when they come in, if they're not wearing a mask, to please put on a mask, or tell them you can't come in because you don't have a mask, and people still don't wear a mask, we do not penalize the store.
Okay.
So it's kind of a fine line there, but we have had some stores that just
won't make the effort.
They don't
Yeah.
ask, they don't believe it's their responsibility. It clearly is their responsibility. In those cases, we have been doing enforcement.
Okay.
But we absolutely, we understand the violence that are going on throughout the country, not necessarily in Massachusetts, but we don't want anybody to put themselves in any kind of danger.
Oh, I can hear it now.
That is when we tell them to call the police, not us.
Barely.
Hey, time out.
I'm out. You see that?
If nobody should be, everybody should be muted.
Muted. They should all be muted.
Mm,
DS is not muted,
and
Let's see that one.
not.
and I don't believe Rosemary's iPhone. Oh, no, it is. Okay. So just
Yeah,
please,
the rest are.
at this point, there's no public participation, so we have to only let the board and the health director speak. Sorry, Ruth.
That's okay. So we advise them that they should politely ask the patron to put a mask on, but we don't want them to get into any kind of confrontation. And, if it's the same person that comes in more than once, we'll work with the police to deal with that.
Okay. Thank you, Ruth.
Do we have
Is
any, do we have any feedback from how they're feeling about all of this, how it's going? Just wondering. They're kind of our partners in this.
What do you mean, the businesses?
No, I'm wondering how Chief Scory is thinking this is going, being that they're our partner. Any thoughts? Or maybe we'll talk about it in the future. We'll see how it's
They're
going.
aware of the responsibility.
Mhm. Thank you, Ruth. Is there anything else, Ruth, that you wanted to include in your health director's report?
Oh, just a reminder about flu.
Oh, yeah.
We forget about that.
Forget about flu since we're so
Yeah.
focused on COVID, but all the school nurses have been given their vaccine to give to teachers and staff in the schools. They got either last week or the week before, maybe 2 weeks, right, Cindy? 2 weeks ago.
Mhm.
And so we're having our first public drive-through clinic this Saturday morning in front of the high school from 9 to 12. We have MRC, Medical Reserve Corps volunteers helping, as well as some of the school nurses helping and board members helping. So we have a good crew and we're hoping a lot of people come. The weather is not supposed to be fabulous, but that's okay. We will be there, rain or shine. And
We have tents, right? Do we have tents?
we
Wear
have
your rain boots.
wear your galoshes and yeah, we'll be there. And we are going to, this one is for anybody 19 years and older. We will, now that we have the rest of our vaccine, we will schedule a family clinic very soon, which will be for people, anybody of all ages, down to age 3. So we have pediatric vaccine that we got for that. This one, and we do have high dose vaccine. I know people ask that. So we have high dose vaccine for people 65 and older. We have regular vaccine for 19 to 64. We have great nurses who are well experienced in giving shots, including the 3 nurses that are on the board. So we encourage everybody to come down and get a flu shot. It's so important this year so that we can help keep the flu down and differentiate flu from COVID and not weaken yourself with flu so that you're more susceptible to serious COVID. So come one, come all.
And there's no appointments necessary, am I correct?
If it's necessary, just drive up and you'll stay in your car and and the forms are actually online. If you go onto the town's website, you can fill out the form and print it out and bring it with you. If you don't, that's okay. You can fill out the form there. Try to wear short sleeves because it's a lot easier to give a flu shot that way. And bring your insurance cards. We take all insurance except Aetna and US Healthcare. And is that right, Cindy? You're shaking.
United,
Oh, I'm sorry.
United Healthcare.
That was close.
Yep.
United Healthcare. And anybody who does not have insurance will not be turned away. Nobody gets turned away due to lack of insurance. So
Mhm.
How did we think farmer's market went? We had booked 141. Did we do that many?
We did, what are the numbers again?
100.
111 regular shots and 44 high dose.
Wow.
That's good. That's very good.
We did, our employee clinic, we did about 70 regular shots and 9 high dose.
And we gave about, was it 180 doses to the schools?
200, because we also gave St. Joseph's and SEAM, so 220 total to all the schools.
Right. Okay.
And was that, the ones to the schools, was that just for students or did that also include staff?
Just,
The theme is students.
they didn't
Okay.
get theirs yet, but they got their staff.
Okay.
We have state vaccine for the students.
Students,
We
the
do that
SEAM.
every year at SEAM. And then we have the vaccine that we purchase for the staff.
Okay, thank you. Okay, anything else, Ruth, that you can think of?
No, we're just very, very busy.
Yeah, it's true. It is. It really is. And I think it should be that, Karen has done a marvelous job being a public health nurse and working with her these last few weeks. She's been wonderful. And you and Cindy have been very, very supportive to her. And I appreciate that. And I thank you for that. That's something we don't always see, but I'll take the time to thank you because I know how important it is to the nurse.
Thanks, Elaine. And I also want to do a shout out to the school nurses. We do have a couple of the school nurses who are also helping out with case management and contact tracing. And that's huge. It's really important.
They have been very nice, very, very nice. Okay, is there anything else? All right, we then will, let's set the date for the next meeting.
Oh, yeah. I think we said it.
Did we? I want to make double sure I have the right date.
No, we didn't, because we've been
Yeah.
and this was perfect that we were able to do this one a little bit sooner, being that we've changed our status.
Yeah.
So November 4th is the first Wednesday of the month,
Yeah.
which I believe,
I will not be available that day.
Okay. The 11th is Veterans Day.
right,
Mhm.
November 15th.
25th is the night before Thanksgiving. Ruh-roh.
No.
Oh, 18th. It should be, 18th is our usual time.
Yeah. Do you want to stick with the 18th, Ruth? And then if there is a problem with something, we can schedule something?
Absolutely. So
Okay.
if we maintain our red status,
Yep.
then I will definitely ask for another board meeting and we can talk about it.
Okay, so we will set the next meeting for November 18th. And that'll be at 7 p.m. Is that good for everyone?
Yep.
Cindy, would you
Yep.
take care of that?
Yes,
Okay, so if can have a motion, I'll see you all on Saturday. I have my galoshes ready and my raincoat.
I'm going to help. What time are you setting up? I'll help set up. I have to leave and then I'll come back and finish up.
8 o'clock, am I not correct? Yeah, 8 o'clock.
I
All
can.
right. So
Do you guys need extra help?
I'm sorry, what? Candace?
Do you guys need some extra help?
I don't know.
Yeah. Do you need extra help?
I think we're okay. We have 3 nurses from the Medical Reserve Corps, plus Karen, a student nurse, another nurse. I think we're okay. I talked to Karen today and I think
Okay.
it seemed okay, but if we need somebody, I will definitely let you know.
Mhm.
Yes, please do.
I will, definitely.
Okay, all right. Can we have a motion to close the meeting? It's 7:30.
I'll make a motion and a comment. We
Yep.
had, people are starting to sign up, but we had over 90 people on the meeting. So that's a
Mhm.
new record for a Board of
Yep.
Health. So thank you all for listening. And usually Mark Sardella covers the highlights and the item very soon.
Yeah.
Thank you all for joining, and I'll make a motion to end the meeting at 7:31.
Motion 7:31, a second.
I'll second that motion.
Okay, all in favor? Gorville,
Aye.
Candace, Linehan,
Aye.
and Silva, aye. So moved. We will close the meeting. Thank you, everyone, and thank you to everyone who's on. It's nice to see people willing to come on and spend some time and listen to the health department. Okay, all right. Good
Thank
night now. Have a
Night.
good night. Have a good weekend. I'll see you on Saturday.
You there.
Okay,
Bye.
bye-bye. Thank you.